Hi, I'm Dr. Rossana Ditangco, or Doc Annie for most of you. I'm a medical specialist here in RITM, but currently the officer in charge of the Clinical Research Division, and I am also the research program lead for HIV of RITM. Officially, I became a medical specialist too in RITM in 1996, but I was in RITM in 1994 because I underwent a fellowship training in infectious disease in 1994 to 1995. That was a joint infectious disease training program of RITM and UPPGH. So basically, I was with RITM since 1994 when I was a fellow. I sort of gravitated towards HIV in RITM because when I was a fellow, we were very much involved in manning the OPD clinic of the HIV OPD clinic of RITM, and we were implementing a cohort study then of Filipinos with HIV. So, and that was being implemented in the OPD clinic. So that's how I started being involved in HIV. And during that time, there was a DOH consultant who started all the HIV program and research in the Philippines, and that was Dr. Ofelia Monzon. And what she did was she sort of mentored me, and I tagged along with her, and she exposed me to to the HIV program, to HIV research. So from then on, tuloy-tuloy na, hindi na nahinto yung aking involvement with HIV. I would say that being heavily involved in the National AIDS STI Program of the Department of Health, because I would say that I really sort of work closely with the program, and somehow the program really consider most of my recommendation in terms of the direction, the national direction for prevention, testing, treatment, and our experience and the data and research that we generated here in RITM very much influence how DOH develop its programs, its policies, its guidelines for HIV prevention and management. And I was able to introduce innovative intervention for testing, for care, and all of these became prototype models that DOH would implement in other areas in the Philippines. Siguro ang biggest challenge is when I hear people who are threatened with what I am doing. But I guess at the end of the day, they would see naman the effect or the benefit of what I am doing, and the output would speak for itself, and you will vindicate yourself naman sa dulo pag nakita naman nila that what you are doing is not for any selfish intention, but it is really for the benefit of patients, particularly people living with HIV. Currently, since we are now at the, parang nasa ano na tayo di ba? We are in a transition into entering the Philippine CDC. I am just hoping that I will be able to contribute in making RITM in a better place and stable at that, and has really earned its niche within the CDC. So I hope I will be able to really lead at least the CRD as we transition into the Philippine CDC, and really show what we can do, and the potential, and what else we can do in terms of research training and clinical care when we become part of the Philippine CDC. Based on my experience, when I was starting, I already had a vision of what I would want to do in terms of my career and my personal goals. And dapat as you mature, you become more selfless, and your goals become more noble. Kasi pagka naman maganda yung intentions mo, kumbaga you will reap the success professionally, and always strive for excellence. Huwag kang maging kontento sa pwede na yan, no? Kung kaya mo talagang i-stretch yung iyong target to excellence, mas mainam yun.